when you're calling in, well, there's Andrew Babinski and the Kim Komando Show Man Cave.
Hey, Kim.
Hi there, Andrew.
Ruth in Nashville is first up.
Okay.
She is a doctor. And as of Wednesday, I know what that's like to have a doctor in the family.
Oh, congratulations.
I'll do a little bragging on my wife's part.
Dr. Babinski.
Yes, we are very proud.
So now, do you have to refer to her as Dr. Babinski now?
Only anytime I look her in the eye. And through text message and email. But otherwise, I don't have to. No pressure.
Oh, that is awesome.
So Ruth has a practice, and some of her patients she had to discharge because of legitimate reasons like, not paying. So these people decided to get retaliation by going online and saying lies and bad things about her practice.
Oh.
And one of the problems with HIPAA laws is she can't go and defend herself because she has to protect that relationship you have with her patients.
Exactly.
So what does she do?
That's a problem right now, is that it's not just with, we'll talk to Ruth, but it's also like a problem with Yelp, Foursquare, and Glassdoor, where suddenly you think that, you can go online, and when people are anonymous online, or they think that they could be anonymous online, they don't always tell the truth, or they don't tell the whole story.
And they're also super mean.
Yes.
Meaner than you would be if you were just face to face with someone.
Yeah, because suddenly it's like, blah, 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 blah. It's, it is. I think that was the...
What was that again?
They get online and they go,
This is a dramatic recreation. I like it.
I worked really, really hard on that, So, hi, Ruth. Welcome.
Thank you.
And so you had to, I guess you'd say, get rid of a few patients?
Well, I've had to do that. Not very many, but some people just are demanding prescriptions that I don't feel comfortable with, or they don't pay, or they're cursing my staff or something that just is not tolerable. And so I've had to dismiss them as a patient. And when I do that, they retaliate. Not all of them, but some of them have retaliated online, like through health grades or through Google evaluations.
Yes. And, it's very disappointing to me that, that people will go online and then suddenly they think that they can be anonymous and they start blasting you when, maybe it wasn't all you, right?
Well, most of the things that they're saying online is not me. They're saying things like I have no medical training.
Oh, okay.
Things like that. They're just total slander.
Well, here's the deal, is that there are numerous cases that are in the courts right now. I mean, if you were just to Google anonymous review lawsuit, you'll see case after case after case, because people are trying to figure this out. There's also a really important case that's still in the court system in San Francisco with a lawyer and a client of this law firm who went online and blasted the lawyer online. Well, then when they blasted the lawyer, remember, the lawyer can defend herself, right? Okay, so
right.
Okay, so the lawyer, of course, she took that into the court system in San Francisco, and they're still going back and forth on trying to figure out, is this really defamation? We know that it's not really anonymous, because a lot of times, I'm sure who is leaving these postings, right? Because
right, I know every one of them.
And and I see that with reviews of, say, our company online too, over at Glassdoor.com. It's easy to figure out who a particular person is. Now, you can have some, and I'm not a lawyer, can't give you legal advice. I can just say, based upon my experience, is that you do have some rights if they expose trade secrets, confidential information, or if it's maliciously false, is what they say. But right now, an employer, an establishment, there really aren't any good options. There's few options. One of the options is that you could actually engage with this person in conversation, which, that's just going down that rabbit hole, right?
Right.
And so you don't want to do that. What we have opted and what our lawyers have advised us is that you come up with a statement and run this by your lawyer and figure out what kind of statement that you could reply with that kind of almost makes somebody else think if they do see it. Like our statement is, Westar has experienced consistent growth over the past 22 years, right? While we respect opinions, we don't condone the publishing of factual false information. That's what our blanket statement is. Okay, so if you wanted to leave a statement, you leave something along those lines, and that's what we've been advised. In addition to that, what you can do is play the other game. And play the game is that for every negative review, try to get 5 positive reviews, right? Because the positive reviews will keep pushing down the negative reviews. And then sometimes when you see the negative review, but you have 20 positive reviews, is that you sit there back and you go like, okay, well, this person just must be crazy, right? You know, they mustn't be with the program, because if I have all these other people saying positive things. So, you know, in your practice, you know, if you have a couple of bad apples, I'm sure you have a whole bushel of happy customers and patients, is that you start asking for positive reviews. And, you know, you can have somebody at the front desk do that, you know, on their way out, say, hey, thanks for coming by today. And, you know, if you like the doc and you like what we did for you, be sure to leave us a positive review so that other people will know that they can have the same experience here. Don't mention the negative stuff, just ask for the positive. And remember, that glass is always half full. Now, you know, this is of really interest to me. So as these cases get settled, be sure to continue to listen to the Kim Komando Show, get the minutes. Also, go over to news.komando.com, because as news breaks, especially on these sensitive topics that affect a lot of people, you can always count on us at the Kim Komando Show to keep you updated.